Much. Thank you for giving us this opportunity. It's ironic because May is Mental Health Awareness Month, so it's really fitting. And I think we're thinking about the spectrum of the world as we know it right now with COVID, and we've really seen an increase of folks experiencing depression or anxiety or in a state of crisis. The longer that COVID goes on and our necessary response, it's leading individuals to be isolated. And if you think of human beings, we're made to be social creatures. So it's really very difficult as the longer that the isolation goes on. I think it's important to think about how that's impacting treatment. You know, whether or not someone has a pre-existing diagnosis or connection to treatment, whether that's mental health or substance use, it's changing it. And, you know, treatment right now is existing for both of those. It's existing, but it's really more remote. We need to do it safely. So it's been over the telephone and using video. But I think it's important to think about for folks that have been utilizing treatment, right now it's different. It's impactful for them. They may feel like they have less resources. They may feel like they have less ability to sustain stressful experiences that we're going through right now, but it's still available. So we do have all of the resources in Monroe County available on our webpage. If you look up mental health on the monroecounty.gov webpage, you will see all of the county providers for substance abuse and mental health. And, you know, they can see new clients, they can see on a walk-in basis. So there are definitely some resources. The best thing that we have for us is each other. We need to keep in mind that when individuals we love, if we're noticing that they're struggling, if it's friends, it's coworkers, it's neighbors, we need to let them know that there is help out there. You know, you can reach out to the county, you can look on the website. That's how we're going to get through this. We may need to have social distance, but we can certainly have the support of each other in this time.
Thank you, Kim. Now, Jason, do you want to come on board and talk about the online Narcan training, and then we'll open for questions?
Yeah, for sure. Thank you. Thanks for having us, and we really appreciate the County Executive Office for giving us this opportunity and for Kelly Wilmot to connect us. So really, addiction's a chronic illness. You know, that hasn't changed, and the opioid epidemic is kind of playing alongside this pandemic that we're all dealing with, and it's being exacerbated in this time frame. So, for example, this time last year we had lost, you know, around 200, we had 200 non-fatal overdoses, and now we're up to almost 250 non-fatal overdoses. In March we had 17 fatal overdoses, and then in April we had 12 fatal overdoses. So the number did go down a little bit over the course of that month, but both of those numbers are about 4 to 6 persons higher than they were last year at the same time. So we're seeing an uptick in overdoses, which isn't what we would really be expecting at this time. And we can't say that that's a cause of COVID, but, you know, there may be a correlation there. You know, last year, Monroe County trained, or not trained, I shouldn't say trained, but distributed 2,700 Narcan kits. And to be clear what Narcan is, it's a life-saving opioid overdose reversal medication. It only works on opiates, and it's completely harmless. It doesn't do anything besides kick an opiate off the opioid receptor inside the brain to reverse an overdose. We are offering now weekly virtual Narcan trainings on Thursdays at 2 p.m. And if you go to the same website that Kim mentioned, monroecounty.gov, go to mental health. It's on the mental health front page there. You click on register. You'll fill out a form, send it in, and then you'll get a Zoom invite. And to, you know, cooperate with social distancing, physical distancing, we would be distributing the Narcan kits to a person's doorstep the day following the actual Narcan training. The trainings don't last too long. We can do it between, you know, under 45 minutes typically. And really, to reiterate what Kim said, is that, you know, all of our providers are still providing services today, just as they were 58 days ago, or however many days we're into this now. So you can get detox services today, you can get outpatient services today, you can get residential treatment today, you can get inpatient treatment today. None of that has changed. You can gain access through walk-ins at many places. Open access is still operating 24/7. That has not changed. And they're seeing some less people than they typically would, which is what we would anticipate. Detox services there's actually beds at Helio Health Detox today. So we had a meeting this morning, and there's beds available today. So there's always been this misnomer out there that we don't have enough care, and we do have plenty of care. We still want people to access it during this time, which we may even argue could be a more trying time than we've been experiencing even prior to COVID. Domestic violence is up 30% around the state. Alcohol consumption is around 55 to 75% higher across the country. Online alcohol sales are up 243%. So we're not just talking about opioid addiction here. There's lots of other chronic illnesses that people are suffering from, mental health and substance use. Really, just the main message is that the antidote to any kind of behavioral health condition is connection, and person-to-person connection is obviously a little bit challenging now, and we want to make sure that people are connecting virtually as much as they can, and that there's plenty of help out there, and that we encourage families and loved ones to try to connect the folks that they need to the care that's out there.
Okay, awesome. Gino Fanelli from City Newspaper, do you have a question?
I do, yeah. This is for Jason. You mentioned the fatal overdoses in March and April. Do you know if there's preliminary numbers for the non-fatals in April yet?
I can look it up for you right now. So April's non-fatals, again, this is just Monroe County data. Through the sheriff's office, so it's not the actual Department of Public Health release data that we typically see a year or so later. So there were 61 non-fatals in April, it looks like, of this year.
Gotcha. And I know during regular times, the county offers Narcan training. Do you see any kind of increase in demand right now for people seeking services? And what's the demand in normal times to begin with?
Yeah, so we haven't seen an increase at any of the outpatient sites, at least, and most of the inpatient or detox sites. We've actually seen a decrease in pursuit of services, which is kind of concerning, right? Because I'm sharing with you that numbers are going up, at least along the opioid overdose rates. And at the same time, we're seeing a stagnation or a decrease in seeking of help. And I think that's along with mental health too. So I don't think it's exclusive to substance use. I think Kim has seen that the intakes at all of these sites are less than they typically would be. And that could just be that people are just not leaving their homes as much as they normally would and not seeking services. But since all these are available virtually, we would like people to really know that they can still get the help that they need. They don't have to leave their house to do so.
Gotcha.
Thank you. Jonathan Hunter from Spectrum. Are you with us, Jonathan?
Yes, I'm here. You hear me?
Yes, we can.
All right, sorry, I just got to unmute myself. Pretty much, you basically answered all of our questions, but, are you guys, want to keep these services open during let's say that we get through the pandemic, and you're still going to try to do more telehealth, still in-person meetings, you're going to try to balance it for both?
I can speak to the mental health side of things. There have been providers that even before COVID were licensed to provide telehealth. But when those restrictions on who was able to provide them really loosened at the beginning of this pandemic, the numbers of providers just skyrocketed. There definitely is a benefit of telehealth, but there's definitely a benefit of face-to-face. And I think as we're thinking about Monroe County looking forward and reopening, that is going to include including face-to-face visits as well for treatment providers.
And I think on the substance use side, it's very similar. Very few providers had the necessary setup to do appropriate telehealth prior to the restrictions being lifted before this. And I think our hope is, as a community, that the state sees what a value telehealth can be and reduces the restrictions that are out there, or that were out there prior to COVID, and continues kind of their laxing of said restrictions, so people can still get help however they need it. So I think, ultimately over the next year, we would all love to see telehealth increase, in-person services, come back, and actually more people being served in the long run.
And one last follow-up question. Are you guys obviously seeing an increase in people utilizing the mental health services in light of COVID?
Can you repeat that? I'm sorry.
Yes, are you guys seeing an increase in people needing the help for mental health services in light of COVID?
Absolutely. You know, people who may never have engaged in the mental health system or the substance use treatment system, it's just a really trying time. You know, if someone's losing their job, if they're unable to interact with their friends and their usual treatment supports, it's pushing all of us to the max. And because of that, we're seeing so many referrals for people in need of help that have never engaged in the system before, which can be good, but we need to make sure that we're providing folks with those services.
All right, thank you guys.
Thank you.
Thank you, Jonathan. Rebecca Fath from WROC, and then Victoria Friel from DNC.
Hi, it's good to see you guys. I think I accidentally put the video up. So hi. How's everybody doing?
Good. How about
All
yourself?
right, thank you.
Good, thank you. Hanging in the nice news garage. So my question really was, I don't know how much you could speak to this because it would probably be more of a question for a pharmacist. But I have spoke to pharmacists off the record, and they tell me that, you know, there's way more people coming in for benzodiazepines like Xanax or Klonopin, things like that, which are highly, highly addictive, controlled substances. And, you know, before COVID-19 quarantine and social distancing even happened, the government was starting to take that a little bit more seriously, that like Xanax is only supposed to be used on a temporary basis. It's not something you should be taking all the time because it's so addictive. So, I mean, that raises a little bit of concern for me because I don't want a bunch more people getting addicted to benzos. Opioids, you know, we already have that problem, and then now we got the benzos that pharmacists are telling me they're all coming in for. Do you know can you speak to that at all, or?
I mean, I think what you're saying probably makes sense anecdotally, right? So Kim shared that the whole country is significantly more anxious than they were 2 months ago, right? So, and primary care doctors can prescribe substances like Xanax or Ativan or something like that, so there may be an increase in that. And we all are in agreement that we do not want to see benzos become a widespread overprescribed medication because they are extremely dangerous. They can cause blackouts when people use them addictively. And really, they're a dangerous drug to withdraw from. They're a significantly dangerous drug to withdraw from. So we definitely don't want to see that be the case. I haven't seen any specific numbers per se of like an overprescription of benzodiazepines locally or nationally at this point. I think it's argued by a lot of people that controlled substances like Xanax or like opiates or whatever, you know, we have a general, or at least had a general overprescription challenge with those medicines, you know, regardless of what's going on in our society. So
Great, thank you so much.
I don't know if Kim's seen any different. But.
I haven't. I do question how much that may play in with the stigma of mental illness, just because, you know, the word with opiates is out there, and it's so hard to go to the identified mental health provider because nobody wants to be viewed as mentally ill just because the stigma associated with it.
Sure.
So it's so much more socially acceptable, and actually we want people to go see their primary care physicians. We want them to get help, you know, for those routine visits. So if that is a substance that may be provided by and prescribed by PCPs, I would question, you know, how much that may play a part as well.
Fabulous, thank you. May I have one more question?
Yep, go ahead.
Thank you. You know, even people with insurance right now, I'm hearing that there's, like you had mentioned, a bit of a wait list. So we do have resources though. There are hotlines if anyone feels like they're having a mental health emergency. We have suicide hotlines, all that stuff. Anything on a more local scale that I'm sure it's the same as what it's been, but if someone, say, has a waiting list and they can't get in to see a psychologist or a therapist for problems with addiction that they may be having, what do you think, as the experts, is the best number to call to get immediate assistance, because there are so many? Should you call a national hotline or something local?
think if you're in need of help today, calling 211 or the mobile crisis line is a really effective way to go.
Okay.
And for addictions, 627-1777, 1 and 3 7s, I'm not sure how many I said there, is the open access 24/7 line. A peer answers that phone 24/7, so I think that's helpful.
Okay. That's perfect. Thank you guys so much, and gals.
Thank you, Rebecca. Victoria, you're up next, and then Alex Crichton from WXXI.
I am having serious technical difficulties here and probably having my own mental health crisis because my children keep coming in to interrupt me. So
that's okay.
We're here for you too.
So I'm literally going to have to re-listen to this entire thing because they were screaming in here most of the time.
That's why I had to come to the office to do this. So for the same reason.
Yeah, and my husband keeps taking the little one back out. So I literally have very little written down because I don't know what was said. My apologies because I don't know how else to do it. It's where we're at today. I've been up since 3 a.m. I'm literally.
Do you want? You can follow up later if you have a chance to watch it and then have questions.
As long as it actually recorded, because again, I don't know what the heck I'm doing.
All right. I might be able to provide you with a recording too.
That was fantastic. And my apologies. I don't know what else to do at this point.
That's okay. Take care of yourself. Alex, you're next.
I thought I was having a rough time. Jeez. I guess this would be a question for Jason. You're talking about the Narcan training. What do you say to people who, may be hesitant to administer Narcan for fear of getting the coronavirus from someone? How do you work around something like that?
Yeah, I mean, administering Narcan is a personal choice, so it's not like you have the duty to do so once you're trained. So we just encourage people to make that decision, however they feel comfortable. And many of the times when we're training people, we're training community members, of course, and we hope that they use it in the community, on anyone that may be unconscious that they come across. But in many cases, people actually get it for administering to people that they actually know, care about, and love. Just someone that they're usually concerned about in their life, whether it's a niece, nephew, mom, dad, brother. So typically people would take that risk for someone that they love. Whether they took that risk for a community member would be entirely up to them and their concern. And we don't, every time I train people, we don't pressure them that they have to administer it in every circumstance that they think it has to be administered in. That they get to make that choice on their own safety and security and such.
Okay, great. Thank you.
Do you have a follow-up, Alex?
I do not.
Okay. Is someone on from 13 WAM? Okay, we're going to go to Patty Singer from Minority Reporter. Go ahead, Patty.
Hi, thanks. I think probably these questions are probably both for Kim. How are you working with Adam Bello and Dr. Mendoza to take a mental health approach to reopening? We hear a lot about physical, the caseload has to go down, we have the capacity in the hospital, but where are the mental health experts guiding folks to say how we should reopen, what should reopen, things like that?
I think we've definitely been part of the conversation, but the driving force that's really maybe in the driver's seat of this, or at least in the front seat if we were a car, would absolutely be the Department of Health. I mean, we're really in the passenger seat, if you think of it that way, but we need to take it through the epidemic. Whether the reopening is sooner rather than later, the people that are right now struggling are going to continue to struggle, whether we're partially reopened, we're wearing masks for the foreseeable future. Just because individuals in crisis, this crisis feels like forever for them. So we've been part of the conversation, honestly, but we haven't been steering it.
I have heard some psychiatrists using the phrase physical distancing instead of social distancing because of some of the things that you said before. How are you working maybe to change that, to get rid of social distancing? That could have been a bad choice of words early on. Move it to physical distancing so we get to keep our connection, only we just get to keep it a couple arms length away. And how important is it to change that wording?
It is extremely important. To get back to what I said at the beginning, human beings are hardwired to be social. We need each other. We need each other to get through this, whether it's in the pandemic, the horrible times like now, or really great times. So, you know, it's so easy to send an email, to send a text, to do those electronic types of ways of getting a hold of someone. You know, picking up the phone, writing a letter, doing things that people may not have thought about for a while. I haven't written a letter in a very long time. We need each other. And the more that we can stay connected and call and check in on individuals that we know care about us or just that we haven't seen in a while is something that's going to allow us to realize that we are in this together. Because a lot of times I think when people are isolated in their house or their apartment, if they live alone or with a small group of people, it feels like, you know, the world is very narrow. So the more socially connected we are, it can definitely expand it. That's a really good point.
So you're going to try to change that wording then? You're going to try to work, is the mental health community going to say, no, it's now physical distancing and get rid of that term social distancing?
Absolutely. Absolutely. It's going to be important for the foreseeable future.
Thank you.
Okay, thank you, Patty. Is anyone on from WHEC? Okay, I think that wraps it up. Thank you both, Kim and Jason, for your time this afternoon.
Can I come back since we're not anymore? I really want to pursue that with Kim. I'm sure you get the answer of the changing that wording, not just the thought of it, but the mental health community working hard to get rid of social distancing and in all the communications now replacing it with physical distancing. There's two very prominent psychiatrists in the community are talking about that. And what's the role of really changing the vernacular to help people get through this?
Absolutely. Patty, I can definitely bring that forward. It's a really good point.
Okay. All right. Thanks, Kim.